Hello and welcome back to another session of interesting endoscopy video. My name is Dr. Pradeep Bhandari and I'm one of the consultant gastroenterologists with interest in endoscopy. The next video I'm going to show you illustrates the advantages of modern technological advances that have been made by endoscopic manufacturers. I'm going to tell you about transnasal gastroscopy, and I believe that that is a true technological advance, as the manufacturers have managed to shrink the endoscope to less than 6 millimeters in diameter, but have still managed to maintain very good picture quality by introducing a super CCD chip into the scope. Now, I believe that the transnasal route also has some very distinct advantages, as I found a lot of my patients find this route more tolerable than the traditional oral route. The reason being that when we introduce the endoscope down the transnasal route, we are not irritating the back of the throat, which avoids retching, and that is what most patients find very annoying and irritating. With transnasal gastroscopy, the risk of retching goes down dramatically. Patients tolerate it much better. They can talk to us during the procedure, so if the endoscopist has missed out on any interesting bit of history, you can check during the procedure. And the biggest advantage is that this can be performed without any sedation, which then moves the gastroscopy from the endoscopy theaters to an office-based practice. So it suddenly transforms the gastroscopy practice into an outpatient office-based practice, thereby increasing the volume of work that you can do. We have done a fair number of these procedures, and I found that the procedure is very easy to perform. The learning curve for the endoscopist is fairly short, and patients find it very tolerable. The clip that I'm going to show will illustrate these points and show you how easy it is to perform and how well the patient can tolerate, as I've performed this procedure on myself to illustrate those points. I hope you enjoy the clip. You can see the nasal endoscope is very thin, of 5.9 millimeters size. Not much thicker than the lumen of my nostril. So you should be able to go through. Yeah, that's correct. This side.
Now you have to swallow.
Come up.
Yeah.
That's it. Lovely geo junction there. Yeah. It'll hinge some gas and stuff.